With measles cases on the rise, parents of young babies may be wondering how to keep them safe, especially since children under the age of 1 can't get vaccinated. Sydney Jolly-Vet joins us with what experts say parents need to know. Sydney.
That's right, Crystal. Infants under 1 are especially vulnerable to measles. According to Johns Hopkins Medicine, on average, 9 out of 10 unvaccinated kids who come into contact with someone who has measles will end up getting the virus. I spoke with an infection prevention expert about the best ways to keep your little ones safe. With over 100 confirmed measles cases across Texas, concern continues to grow. And for babies under 1, the risk is even greater.
The recommendation for the first dose is between the age of 12 months and 15 months, and then the second dose would be between the age of 4 years and 6 years.
In some cases, infants between 6 and 11 months old can get the vaccine, but only in extreme cases like international travel or measles exposure within 72 hours.
The reason for that is just because the baby's immunity is usually not developed enough to build that lifetime immunity from the vaccines at that young age. So even if we administer it before the age of 12 months, they would still have to have the 2 scheduled doses after that.
So what can parents do? Since the first line of defense isn't an option for babies under 1, the next best choice is following basic healthcare precautions.
Stay away from sick people, anybody with any kind of rash, cold-like symptoms. Make sure that you're cleaning your hands, disinfecting any surfaces that are commonly touched. Try to get plenty of rest, plenty of sleep, and eat healthy.
If you have to go out, you might think a blanket over the stroller will help. But Dr. Dalrymple says that's not enough.
Measles virus is actually very tiny, and it can pass through most of the usual mask. You would have to have an N95 filter in order to be able to filter that out.
Another way to keep your baby safe, herd immunity. If the population is 95% vaccinated, measles is less likely to spread. Until babies are old enough for the vaccine, prevention will always be key. And Dr. Dalrymple and medical professionals at MCH encourage everyone to remember, if you feel sick, do not go straight to the hospital. Contact your healthcare provider so they can take the appropriate precautions to prevent spreading the virus.